Hi everyone, I'm Secretary Ramsey of the Labor Cabinet. I'm joined by Brittany Burke, Program Director at Norton's Hospital, as well as Ellen Denham, a nursing student at Norton's Hospital. So welcome, ladies.
Thank you. Thank you for having us.
Yeah, my pleasure. I want to start with you, Brittany. Why is it important to have an apprenticeship program at Norton's Hospital?
Sure. So apprenticeships are important. It provides on-the-job training with education. And so with the market being in a need for nurses right now, Norton Healthcare really strives to be innovative.
Okay.
We are a National League for Nursing accredited Center of Excellence.
Okay.
And so one of the jobs that we have is a pleasure of developing programs to benefit nursing education.
Okay.
So this program was developed to combine education in academic setting
Okay.
with the organization that we have in the acute setting, the hospital setting. So the program was developed to complement education and not compete with.
Okay.
And so with nursing having that market need, with nurses in need in general, and with hospitals being the primary location for new graduate nurses,
Right.
we thought this was a great opportunity to bring the apprenticeship model into the healthcare setting.
Having said that, I know here in the state of Kentucky we have over 70,000 nurses.
Yes.
But we also stated that over the next 5 years that we're going to need about 5,500 or more nurses.
Yes.
How do we handle that shortage?
I believe handling the shortage with education, with really involving our students into practice. It's one thing to go to school and to learn. Basic fundamental textbook knowledge is important.
Right.
But the application of that is where nurses thrive. So being able to bring nurses into the healthcare environment as a student, having them have those opportunities to learn with doctors, with providers, with nurse practitioners, with respiratory, with bedside nurses, with our secretaries, with our PCAs, and really understand the fundamental of what healthcare is,
Right.
will help boost the population for nurses. Nurses are really big on patient outcomes.
Okay.
And so for us to have the ability to provide safe care, to provide confident care, and being able to develop programs to where we can excel in those areas is really how I feel we're going to tackle that nursing shortage.
Okay.
We will grow, we will develop, we will expand.
Right.
And apprenticeships is just one way
Right.
where we can be innovative in
Okay.
bringing those concepts together.
So, having said that, Ellen, welcome again.
Thank you.
Having said that, the concept behind apprenticeship is to be able to learn in class and then go and apply it. Has that been a big benefit to you?
It has. It's been an opportunity for me to work alongside a nurse under their supervision and be able to get that clinical experience that you normally wouldn't get in nursing school. You know, you have your clinicals in nursing school, but it's nothing one-on-one necessarily. So being able to work in a specialty unit where I want to work when I graduate has been a really good opportunity to get that education and that extra push for what I'll need when I become an RN.
Okay.
Yeah.
So as you look at Norton's, what are the goals of Norton's Hospital when it comes to nursing and healthcare?
So I always say there's two things that stay true in healthcare: patient safety and change.
Okay.
We know with evidence-based practice that's something that we strive on with Norton Healthcare. Evidence is good right now for about 5 years.
Okay.
However, it takes about 17 years to truly implement that change. And so what Norton does a really good job of is taking the evidence, driving it forward so that we can have improvements in patients' outcomes sooner,
Okay.
more effectively. As nurses, we know that one day we will be those patients.
Okay.
And so it really gives us pride to know that the care that we deliver is impactful, that it's purposeful, and that we are servant leaders. That's what we do in healthcare, and that's what we do as nurses.
All right. Now, you said you got into it because you want to help people, and you said also off camera that you were wanting to be involved with little people, and that's what drove you to this profession. Share with us a little bit more about that.
Yeah, so I do love little people. I love the babies. Kind of got into the NICU, the neonatal intensive care unit. I love watching the little babies and the ones that just need a little bit of extra help. I love watching them be admitted and then grow under our care, getting to work with the parents, and then being able to discharge them home to where they're healthy and get to go live a normal life with their families. So that's been really awesome, getting to see them grow and reach their full potential. And babies are very resilient. That's one of my favorite things, is just seeing how well they work with the nurses and how they are with procedures, and just very resilient little humans. So it's nice to work with them. Yeah,
Right. Okay.
they're wonderful.
Brittany, as you look at where, and our program's only about 3 weeks old, as you look at it, what can you say to and having been the first one in the country as well,
Sure.
congratulations.
Thank you.
And I'm happy to be a part of that as
Yeah.
well. But as you look at it, what would you say to other hospital, other healthcare units, other healthcare professions around the state and around the country? What would you say to them?
I would say dream big, be creative. Analyze your needs for your hospital or your healthcare organization. See what those needs are. Talk about them. Don't be afraid to throw out ideas, brainstorm. Don't take anything off of the table. I know when we developed the apprenticeship program as it stands now, that was the concept. Research isn't available for it.
Right.
Most programs with student nurses are a summer only.
Right.
And so we really developed a concept for an idea that is now reality based off of focus groups with student nurses, based off of leaders with nurses. Based off of meetings with nursing leaders.
Right.
My experiences as a new grad nurse, as a preceptor, as a bedside nurse, as an educator, talking to schools of nursing, their faculty, and really saying what is the need? How can we provide that service for our patients? Because really that's what it's about.
Right.
It's for our patients. And so how can we better prepare our frontline staff, our staff that provide that care directly after they graduate? When they are licensed, that should not be the first day that they feel confident in their practice. So by going back in nursing school, developing a program, as I said before, that complements the academic world is really what we strive for in healthcare, is to be innovative, is to dream big, is to put patient safety first. And so I would challenge other organizations to do the same thing. Dream big, be innovative, and put patients first.
Having said that, dreaming big, putting patients first, where do you see this at in the next 5 years, 10 years?
Oh, I would love this program to be the entryway for all new nurses at Norton Healthcare.
Okay.
I would love to have the ability to welcome as many nurses and nursing students who want to be a part of our organization prior to graduation. In addition, I would love to see this model continue throughout the state, continue throughout the country. Because one thing with Norton Healthcare that we strive is not just our patients, but population health.
Okay.
And so by being able to immerse this type of academic collaboration with schools, this partnership with schools of nursing throughout our country, really will benefit not just our patients locally, but our patients within the nation.
Got it. Now, coming out 1 year from now, you're a senior. What do you tell the sophomores, freshmen that are interested in nursing, and juniors? What do you share with them about your experience?
Take advantage of opportunities like this. I think that this opportunity will be one of the biggest blessings that I've had, to be able to feel more confident, not only in myself, but in the way that I care for the patients. I've gotten to learn a lot alongside the nurses, how they do it and how they take care of their patients, and really get feedback from the families, especially about how much that meant to them. I've been a patient before at Norton and have received the best care, and that's also one of the reasons why I wanted to become a nurse. And so I'm hoping that by doing that, and by other nursing students seeing this program grow, that they'll learn to appreciate programs like this that help them in their future career.
Having said that, share with us some of the challenges you've had.
Yeah, so one of the biggest things, especially working with little babies, is understanding that bad things do happen. You know, you celebrate the gift of life, but then you also have to be prepared for bad things to happen. So within my first couple weeks of the program, we actually ended up losing a baby. And that was one of the hardest things I think that I've dealt with, and kind of questioned, you know, how do you continue to care for the other patients once you lose one, you know? So that was one of the hardest things that I've had to experience so far, but with the other nurses that have been there for years, they help pull you out of that. You know, it makes you want to take care of those other ones so much more. You want to continue to care for them and get to see them grow and go home. So it has been a challenge, but it's definitely been very rewarding.
Yeah, in particular early in your career.
Yes, absolutely.
Yes. As an administration, what was the thought process that went into it that Norton's had to kick around before they came to the conclusion that this is a good idea?
Well, we are blessed at Norton Healthcare, and the fact that our nursing leaders are phenomenal. So the idea of this program wasn't as much of a challenge as an opportunity.
Oh, okay.
So we looked at it as, how can we serve our patients? And service is leadership. Service is the professional aspect of nursing. Service is the soft skills, the hard skills, the tangibility of practice, all of those things. So the ability to pull leaders across our system, our organization, to say, here is a need, do you agree? And to have a unanimous yes was very exciting, was thrilling, and was motivating. So I would have to say, it was an opportunity. The challenge of it being, how do we let our students know that this program exists? And thankfully, we hit the ground running. So for the first year of the program, we had more students apply than we ever anticipated. We only see that growing, and then therefore our service to our patients continuing to grow.
You know, the interesting part about that, when we talk about the whole apprenticeship notion, you know, because so many times people in the university setting, they learn, they get a diploma, and then they have to go to a job site and learn again.
Sure.
Now, with the apprenticeship, where you learn and then apply, is a notion that has been around forever, and so we're just more than excited that Norton's decided to be a part of our program.